Welcome to the audio description of the visual summary of the Connecting Voices Conference. This event was run by the Race Equality Public Action Group, or REPAG, on the 1st of May 2024. The REPAG is hosted by the National Institute for Health and Care Research, or NIHR. The visual was created by Sky McCool, a live scribe and creative engagement freelancer. You can follow NIHR Involvement on Twitter using the handle at NIHR Involvement. And you can follow Sky McCool using the handle at sketch_Sky. There were 7 public contributors speaking at the conference, on 6 different topics. The visual shows 4 talks in the top half and 2 in the bottom half, with a banner across the middle saying, "Reflective Music, Speaking to Our Humanity," to represent the carefully selected music that was played in the webinar's 2 intervals. We will now tell you about each talk in turn.
The first part of the visual summary shows us Royston John's talk about intersectionality. There is an illustrated portrait of Royston, a dark-skinned black African heritage man approaching 70, with glasses and a full grey beard. Royston is wearing a pale shirt. His portrait is alongside text and icons representing a few key points from his talk. Intersectionality is an indicator of a blend of race, gender, and more. It reminds us to pay attention to the whole person. There is an image of a Southeast Asian woman wearing a headscarf in a wheelchair with one leg. Around her there are several icons to signify different aspects of who she is: a heart, house, exclamation mark, question mark, and light bulb. We should meet people before creating research questions. There is an image of a white person shaking hands with a black person, whilst talking to them about research questions. Persisting inaccurate beliefs are influencing people's care and their health outcomes. For example, black women are not being given pain relief, and travelers and Romani people are dying younger than others. There is an image of pills crossed out, and an image of gravestones with flowers on them. At the bottom of Royston's talk is a banner reading, "We want research for the people, not people for research."
The second part of the visual summary shows us Faye Scott's reflective piece. Above her talk is a banner reading, "We live our lives in color, all of us, our lives are intertwined," a sentiment she shared in her opening of the conference. There is an illustrated portrait of Faye, a black woman wearing a black shirt, alongside text and icons representing a few key points from her reflective piece. Faye says, "I am a human being, treat me as I am." There is an image of people being fed into a machine and a research report coming out the other end, with the words extract and take and fake. The phrase head and heart sits alongside an image of a heart being filtered out. Tainted by history sits alongside an image of a rose-tinted magnifying glass, analyzing a person. And finally, Faye says, "I see hope, aspiration, and purpose." This is accompanied with an image of a black person looking at themselves in a mirror. Next to her talk is a speech bubble, showing something that a webinar attendee said about Faye's piece, powerfully speaking to the heart of the matter.
The third part of the visual summary shows us Joyce Dutch's talk about living life in color. There is an illustrated portrait of Joyce, a black woman wearing a cream and orange shirt and dark glasses, alongside text and icons representing a few key points from her talk. Neurodiversity for Joyce means that her brain works differently. She needs calm and serene to work with her physiology. The word fighting is in large letters, alongside the words to breathe, to be heard, and to be me. People are having to deny or mask parts of who they are or parts of themselves. Joyce says she is a unique individual with her own toolkit. She is not a label. To write, read, communicate, and be with others, she is overwhelmed. When asked how services can be improved, Joyce explained how accurate health records are essential for better outcomes, and that effective communication is key for health experiences. Finally, at the bottom of her talk is emphasized text saying, "I am an equal member of the human race."
The fourth part of the visual summary shows us Alan Chetham's talk about the social model of disability. There is an illustrated portrait of Alan, a white man with shaved head and facial hair, wearing a grey t-shirt, with his opening sentiment about his life-changing role as a public contributor. His portrait sits alongside text and icons representing key points from his talk.
Everyone's life experience is different. Alan spoke about how things have improved, but there is further to go for reality to meet aspiration. He spoke about attitudes to disability having shifted over time, referring to how healthcare staff used to threaten families and children to behave in waiting areas, or define and name people in their care by their impairments. Alan described how accessibility in healthcare facilities has improved, which reduces people's worry, improves their mental health, and as a result improves their treatment and outcomes. He shared personal experiences of triggering behavior from healthcare professionals, and how triggers cause previously managed anxiety, worry, depression, and hurt to surface again. One of these triggers is talking to his partner whilst ignoring him, and treating his disease but not considering the whole of him. He highlights how it shouldn't be up to him to call this behavior out. When asked what needs to change, Alan discusses audible lifts, more parking for disabled users, employing disabled people, and changing attitudes toward him as a blind person. One of the webinar attendees thanks him for sharing practical examples.
The fifth part of the visual summary shows us Asima and Farzana Khanum's talk about a positive aspect of healthcare, which focused on maternity services. There are illustrated portraits of Asima and Farzana. Asima is a South Asian woman in her 30s with brown eyes, wearing a grey headscarf and a black top. Farzana is a Southeast Asian woman in her mid-40s wearing a black hijab and blue scarf around the neck. Their portraits sit alongside text and icons representing key points from their talk. Asima shared her personal experience of maternity services, explaining that people like her are not receiving the same level of care or signposting. She told how she was denied pain relief, with a healthcare professional saying, "You are just wired differently," and how this led to postnatal depression. She spoke about how maternity care had led her to feel mistrust, angry, shocked, hopeless, and voiceless. Farzana described how a woman's most vulnerable time is labor and childbirth. She explained how her experience was positive, but she had witnessed discrimination due to a new mother not speaking English. When asked how experiences could be improved, Farzana and Asima discussed training, support, and a desire to change. Training for midwives and healthcare professionals, spanning care, empathy, cultural diversity, and language. More support and information provision for every woman to feel prepared, mentioning breastfeeding, helping mothers to look after their health, and the possibility of peer support workers. And there needs to be a real want for change. No matter who you are, you should get the same level of service. This sits alongside an image of white healthcare professionals raising their hands, under a banner saying, "We want to change." Webinar attendees asked about Farzana and Asima's views on the NHS patient feedback surveys. Farzana and Asima spoke about the need to make patients aware of the system, how qualitative feedback is better, how the experience of people like them means they should be at the heart of feedback, and how the survey is not always accessible due to language, anonymity, and a fear of backlash.
The sixth part of the visual summary shows us D. Cooper's reflective piece, titled Breaking the Silence. There is an illustrated portrait of Dee, an English Romany woman, with very long blonde hair and blue eyes, and lightly tanned complexion. She is wearing a black top, in her late 40s, and smiles a lot. She is saying Kushti Divas. Her portrait sits alongside text and icons representing a few key points from her poem and responses to questions. There is a sign reading "No Gypsy served here." Dee shared how she has never known life without discrimination. A person asks, "Can mother bring in her crystal ball?" alongside them imagining a cliché image of a young gypsy woman with dark hair, lipstick, and revealing clothes. There is a scene of green hills with disappearing people and cars, alongside three phrases: family, friends, the ones we trust, things began to disappear, and we will not leave, we're here to stay. Dee goes on to explain how healthcare provision was neglected because of their nomadic lifestyle. But how most Gypsy, Roma, and travelers are now housed, yet still receive poorer healthcare. She mentions a growing mental health crisis among men in the GRT community. When asked how people can engage the GRT community, D explains that it's other people's fear of engaging them, not the GRT community not engaging. She tells us how anxiety is seen as aggression, and highlights the need for building trust in a context of centuries of mistrust. Finally, she suggests more visual and online engagement approaches.
The final part of the visual summary shows us a few participant and speaker contributions from the final plenary. These include reflections from speakers and participants' responses to a prompt to commit to an action for change. The points shown include: we all need to be able to speak up and have a voice. How do we work together to address the negative experiences common to all of us? This sits alongside a diagram showing 4 overlapping circles for neurodivergent, culture, women, and disabled. We need more spaces like this for experiences to be heard. I have lots to think about to improve how my team designs and delivers research. I will introduce the speakers to my wider team. My action is to increase the lens through which we plan our evaluation of good practice research inclusion. We will work on our PPIE group to ensure that we are reaching all the population.
That brings us to the end of the audio description of the visual summary of the Connecting Voices conference. Thank you for listening.